The North West is in need of an emergency COVID response. For weeks, there have been concerns about the rise in cases. The Indian variant has been dominating this part of the UK. Today, the Health Secretary confirmed Greater Manchester and Lancashire will get extra government support.
I want to encourage everyone in Manchester and Lancashire to get the tests on offer. We know that this approach can work. We've seen it work in South London and in Bolton in stopping a rise in the number of cases.
His announcement of extra vaccines, more testing and military support may be welcome, but the package comes with caution. Minimise travel and only meet people outside where possible. Additional guidance when lockdown should be completely lifted in just 13 days.
I think we've got to stop hitting one part of the country against the other. And I think, where we have spikes, we have to do more of this, not put people into localised lockdowns.
It feels like it's always the same areas. Why? I don't understand that. Again, I'm not a conspiracist or anything, but why? Why is it always the same areas?
5 of the UK's highest infection rates are in Greater Manchester. Whilst the region's mayor has been one of the government's biggest critics during the pandemic, he welcomed these new steps.
Work with us, let's do what we need to do. Let's leave local lockdowns in last year. Let's not go back to any of that. Don't worry the public with the threat of that. Carry people with us, and I think we can do it.
Boots on the ground in Bolton have helped this town's cases flatten. The same strategy will now be seen in neighbouring Lancashire.
If you look at the percentage of people who've had 2 doses, there is quite a variation from as low as 42% in Pendle to 64.2% in Scarborough, for instance. So it just goes to show that these places are very different and they need differential support.
This region has been here before. It's vulnerable to restrictions once again. And tonight, over 4 million people find themselves staring down the barrel of a step backwards.
Anybody who you speak to probably say that we've had enough of it. If they put more guidelines in place, well, are people going to stick to them?
I understand that it's still a big health risk and we've got to be careful with those concerns. I also want to kind of get life going again because the people that I'm close to that are at risk have already been fully protected against it.
Mental health is key at this point, and the amount of lockdowns and how we've been messed around, it's just ridiculous. It's like no one's thinking about how this is affecting us as people.
Like the rest of the country, people here want to feel full freedom in 2 weeks, but there's a clear hurdle on the road out. Inzamam Rashid, Sky News, Manchester.